All set, everyone? All right, well, good afternoon to everybody who is here, and thank you as always for making the time to ask questions of us. I still believe it's very important. There's a lot going on, and as luck would have it, if you will, you all probably just saw the release that we just sent out informing everybody about a large house party that occurred in Pittsford in a home of in the basement of a home on Sunday, August 23rd. We actually just learned about this late yesterday evening, and so this wasn't even part of the thinking in having today's conference, but it's well timed nonetheless. So we are in the middle of the investigation at this time, so we are not prepared to release too many details because we want to make sure that we have the details correct. But we do know that the party occurred on Sunday, August 23rd in the basement of a home in the town of Pittsford, largely impacting students of the Pittsford Central School District. We have confirmed that there is one individual who has tested positive. We are in the process of doing the contact tracing, identifying other people who may be positive, and we are also now quarantining anybody who we know to have been in close contact with that individual. Because of the nature of the circumstances, it being a party in a basement, we are hoping to inform the public, particularly parents of any student, child who may have been at this party, to call us, to confirm, to do what we can to clarify any risks, but barring that, to self-quarantine through Sunday, September 6th, which would be 2 weeks from this incident. We recognize that school is upon us, and so we want to exercise an abundance of caution to do everything we possibly can to keep students safe and free, and so that we can reopen the schools. So I'll take questions about that later on, but in spite of all of this, I do believe that we are still very well positioned as a community as we go into the September and October months, as we go into reopening schools. The prevalence of COVID-19 in our community is thought to be still very low. And although we are still seeing examples like this of small outbreaks, I don't want people to confuse that with a change in the overall prevalence of COVID-19 in our community. Our job in the health department is to identify these clusters, to notify the public as appropriate, to take all the precautions we can to try to keep the prevalence low overall. And so while I can understand while this news might feel alarming, from my standpoint, it's not surprising. We anticipate this. And frankly, the more of these that we can find and intervene upon, the better standing we will be in to keep the prevalence of COVID-19 down in our community. Obviously, the sensitivity right now is that schools are opening, and we're coming up on the 14-day period before schools open. And so we want people to be thinking about, is now the right time to be taking trips outside of the area that are perhaps something that you can defer to another time. Be thinking again about having gatherings in your home, particularly large gatherings indoors with people who are not using precautions for extended period of time. This is not the right time to be having to be taking these unnecessary risks. And likewise for visitors, I understand that summer's wrapping up. We want to see any loved ones who might be coming in, but again, think twice about inviting visitors from other areas. And I don't just mean other states where the prevalence might be high. These could be visitors from other parts of New York State, or people who you might believe are not taking appropriate precautions. Because at the end of the day, what really is the risk are these gatherings. And as we've seen throughout the summer, it's these gatherings of people, large gatherings, particularly indoors, although outdoors is not entirely protective, between people who are unmasked for long periods of time. These are the gatherings that we're trying to ask people to be thoughtful about. So with that, I will open up the floor to questions. I think there are probably a lot of questions about testing and schools and gyms. So let's open up the floor.
All right, we're going to start with Jennifer.
Hi, Dr. Mendoza, Andrew Freeman from Subter News. Thanks for talking with us this afternoon.
First up is Jennifer Lukey from WHCC, followed by a reporter from WHAM, 13 WHAM if somebody is on. Go ahead, Jennifer.
Hi, Dr. Mendoza. Can you hear me okay?
Yes, I can. Thank you.
Okay. I had a couple questions about this Pittsburgh situation. I guess if you could, can you elaborate on the size of the group, what the nature of the event was? And I'm assuming this particular minor showed symptoms.
Yes, what I can tell you is that this individual did have symptoms. We are still working to confirm the size of the gathering, but I will say it would be in the order of several dozens in the basement of a home, which most basements of most homes are not as well ventilated as even other parts of the home. And so given what we know at this time, given the potential size of this house party, we thought it better to inform the public because of the uncertainty around all of the details. And we are in the middle of the investigation, trying to contact as many people as possible. And hopefully we'll be able to reach everybody, but I do want to enlist the support of the public in helping to complete this investigation.
Do you think it is over that 50-person threshold? And if so, who do you contact about that? Is there any repercussions for perhaps the owner of the home?
Well, we don't know that for sure. And so I'm not really as concerned about trying to get anybody in trouble. I really do want to just look out for everybody's health. And so that's our first priority at this time.
Thank you.
Thank you, Jennifer. Next up is a reporter from 13 WHAM. Doesn't sound like it. So we're going to go ahead to Patty Singer, the minority reporter, followed by Sean Lehman from the DNC.
Hi. So I want to go kind of off topic for a second on this is how has COVID affected the fact that we still don't have any opioid numbers from last year? And that's still an issue for lots of families. And there's going to be some memorials for victims of the opioid epidemic coming up this weekend.
Indeed. Well, the opioid crisis remains a top priority for us here in the health department as well as across the community. We are finalizing the numbers from 2019. The total number of overdoses will be less than it was in the prior year in 2018. So that is good news, but it's not going to be a major decline. And obviously the priority is still very, very high for us. We're expanding our workforce around opioid prevention and overdose prevention here in the health department, and we'll have more details forthcoming in the coming weeks.
So when you hear about house parties or gatherings, you're dealing with one crisis, dealing with another. I mean, how do you feel that maybe the messages has to change to get out to people that we're dealing with two public health crises at once, and that is really stretching our resources?
Well, I think we're always dealing with more than one public health crisis at once. In fact, we're dealing with many all at once. And my message to the public, particularly around COVID, because I think that's the acute issue. As we look to reopen schools, so much effort is going into that. We want to put all the odds in our favor as best as we possibly can. The opioid crisis is obviously a very, very important, chronic problem, and we're paying a lot of attention to it. But I don't see them, necessarily in the same problem. They're both separate priorities for me.
Thank you.
All right, Sean Lehman from the DNC, followed by Andrew Freeman from Spectrum.
Yeah, good afternoon, Dr. Mendoza. A question about schools reopening. What's the recommended response for students or teachers who get sick with respiratory symptoms that might simply be allergies or common cold? Are you recommending that they get COVID tests? There seems to be some confusion among parents as to whether schools are going to require a negative test for kids to return to school.
Right. So there's no confusion at this time. The current guidelines require that schools need to see a symptom resolution, a note from that child's healthcare provider, and a negative COVID test. So those are three requirements that the schools will be held to in order to allow a student to come back to school. Those are the guidelines as they stand right now. There's a lot of enthusiasm to trying to figure out whether those guidelines can be made a little bit more nuanced to allow for people who have chronic symptoms, for example, chronic allergies. What accommodations can be made there? Because at the end of the day, we want to be able to reopen schools safely, and a child who we are confident has a chronic, allergic rhinitis concern and no concern for COVID, those kinds of things we want to leave up to the healthcare providers. But the current guidelines right now are very black and white. You need to have symptom resolution, a letter from your healthcare provider, and a negative COVID test.
Thank you. And are you confident that we have enough testing capacity here to handle if there are outbreaks here? in the
Well,
schools?
certainly our goal is to prevent the outbreaks, but we also need to prepare in the event that we do. Our larger priority at this time is preparing for if we need to require everybody who gets sent home from school to have a COVID test. So based on our estimates, we're gonna need to have about 1,000 additional tests per day in order to accommodate that based on, absentee rates from prior years. Those are just calculations based on normal years, and there's nothing normal about this year. So, we're trying to pay close attention to this, trying to anticipate demand. But that is the priority. My hope from outbreaks is that won't be nearly as great as the need to test people before they return back to school.
Okay, thank you.
Thanks, Sean. Andrew Freeman from Spectrum, followed by Ashley Collins from WROC.
Who's that?
Oh, sorry. Hi, I missed you. How are you? I wanted to ask first just a quick off topic about Governor Cuomo announced yesterday that some rapid testing sites were coming to Western New York, like the Buffalo area, tests that you could get your results in less than an hour. I was wondering what your thoughts were on those kind of tests, if those tests might be coming to the Finger Lakes soon, and if that could be a game changer with schools starting back up.
So, when I read that, my first reaction is what's going on in Western New York. It does turn out that it looks like their numbers are going up. So it does make sense to test more there. The tests that have the rapid turnaround are antigen tests. Those tests have a high specificity, but a lower sensitivity, which means that a positive is a positive, but a negative will need to be confirmed to make sure that it's negative. So at the end of the day, more testing is a good thing. And, as to whether that would be a game changer here, certainly it would be if we had an increase in numbers. But that is not the kind of test, because of its low sensitivity, that you would want to use in a screening or surveillance situation.
And then my next question will be about, we were talking just earlier about how multiple public health crises happen to go along the same time. How do you juggle, we're about to enter flu season and COVID-19 is still around?
Well, there's never just one thing. And since my beginning in my tenure here as Commissioner of Public Health, I've always focused on trying to cross-train our staff. We have upwards of 230 dedicated professionals here in the health department, and there is always something around the bend. And so to the extent that we can inform ourselves with data, strengthening our data team, making sure we have good people who are doing outreach that is not specific to a particular concern, but outreach around prevention of chronic illnesses. We want to focus on the impact of trauma, because we know that's cross-cutting across a number of public health concerns. So, I've been working to develop a workforce that's well informed about all of the issues around public health. And so when the next thing comes along, it's not as much of a pivot to focus on the new thing. But flu is not new. We have been trying to promote immunizations to influenza since the beginning of the influenza vaccine. And so that won't be new. But the new wrinkle, of course, is that it's going to be in the setting of a global pandemic. So, we want to remain nimble and follow the data. But a lot of what we're doing is practicing things that we've been doing before.
I guess finally, I just asked about the Pittsford party with schools starting to back up, colleges. Do you anticipate more of these things to happen? And if so, what would your message to young people be?
I think I do anticipate more of these happening. We've seen this throughout the summer already, and it just so happens that this is a party where we're not able to identify everybody. But so the acuity in this case is that we want to identify everybody we can, and that school reopening is around the corner. But every time we've reopened something in our community, we see a little bit of a change, and then we've got to regroup. My message to the community is, at the end of the day, we need to double down on the same precautions that we've been talking about: wearing your mask, keeping 6 foot of distance, and washing your hands. I mean, those 3 things are the most important. The highest risk interactions are indoor among people who are unmasked, less than 6 feet away for long periods of time. Those are the things that we want to be thoughtful about. Avoid them whenever possible, and be thinking about who you are with, because at the end of the day, with a low prevalence like we have right now, the vast majority of people in our community are not contagious, are not infected. But the reality is that we don't know who among us is. And so the better part of caution is to proceed as though anybody could be. And that's why I wear my mask, even though I'm quite confident right now that I don't have COVID. We just don't know.
Thank you, Dr.
Sure.
Next up is Katya Collins from WROC and then Brett Dolger from WXXI.
Good afternoon, Dr. Mendoza. My question has to do with back to school. As we're going back and we're hearing these cases pop up, what metrics are you guys looking at to say to when you guys are going to step in? What are you looking at, and at what point do you step in and say we might need to shut down, we might need to back down?
Well, we are looking at very micro level metrics. Whenever we see an outbreak like this, if we can trace our way to all of the people who might be at risk, that's very reassuring. If we're at the point where we're seeing more cases of what we call community transmission, meaning cases that we're not able to explain through contact tracing or through existing cases, that will make me more nervous. By the time we start to see test positivity rates increasing, right now it's around 0.8%. When we start seeing that going up, it's going to be very hard to turn back the tide. So my goal is to identify everybody we possibly can through testing, tracing, and isolation, because that's where we stand the best chance to keep that overall number down. Once that number starts trickling upward, it's going to be very, very difficult.
And then a follow-up to that is, as far as who should get tested, when should you be going? This is just for everybody, not just for back to school, but when should you be going to get tested? Is it just when you have symptoms? Is it if you're in an essential job? I mean, when exactly should everyday people be going to get tested?
I think the more important question around getting tested is how you interpret the result. If you want to get tested, go get tested. I think we should minimize barriers to testing as much as we possibly can. And I also know that there are not infinite numbers of tests. So, if you feel unsure, get tested. It's the same message that we have with other types of viruses like HIV. If you're unsure, get tested. But know how to interpret the result appropriately. And do not take unnecessary risks just because your test result is negative. Anybody who is in an essential field who has a higher chance of exposing other people should definitely consider getting tested. But at the end of the day, continue to take all the same precautions.
Thank you.
All right, Brett Dolger from WXXI is next, and then we'll do a second round of questions, starting with Jennifer Lukey again.
Great, thanks. Can you hear me okay?
Yep.
Great. I've seen studies that seem to show that there's not a lot of risk of transmission in young children, and other studies that seem to show that the risk might be higher. And I wonder if you can offer some interpretation of how safe it is from a health perspective to reopen schools, and also what kind of balance you're trying to strike between health per se and the social issues that come with not reopening schools.
Sure. So when it comes to those studies, as you've pointed out, we have studies that on the face of them seem to conflict with one another. My interpretation from the perspective of Monroe County is that we don't really have any good studies that tell us exactly what to do here, because our community's kids have not been interacting like they normally would be. And so I need to approach this as though it is definitely possible for kids to transmit the virus from one to the other. And we have good evidence of that. Whether they do it more or less than adults is unclear, but we know it's possible. And I think the most reassuring fact is that we have a low community prevalence right now, and that's how we want to keep it. And so I do think, though, that we are safe to reopen schools, largely because we have a low prevalence. I'm eager to open schools safely, because there are consequences to keeping the schools closed. And you mentioned many of them, the mental health impacts, the socio-emotional impacts. Those things are critical for our kids. And I don't think it's all about safe or not safe, risky or not risky. I've said all along, there is no zero risk path through a pandemic. And so, we are taking calculated risks every single day, whether we are aware of them or not. And in reopening schools, yes, it is a calculated risk, but not reopening schools would also be a calculated risk. So I think we need to be thinking about this in a very nuanced way. And I think that's why I want people to be thinking about their risk from the standpoint of who they're with, what they're doing, their precautions, and the consequences of not taking those risks.
Thanks. I also want to ask about the rising test positivity rate in Western New York, which is not that far away, an hour down the thruway to get to Buffalo. And I wonder if you've got any concerns about transmission across regions, and also whether you've got any read on what the Finger Lakes region might be doing differently that's resulting in a stable positivity rate while it rises not far away from us.
Well, as close as Buffalo and Erie County are, what really matters is the transmission of people between the two. And that's why I think we need to be thinking about, not to say that we should prevent travel to and from Erie County, but we should be thinking about people who are interacting with from outside of our region, because potentially they are people coming from a region with a higher positivity rate. But that being said, there are people in our region right in front of our noses who have the infection, and we don't know. I think what I can say about this community is that people have been exceedingly supportive and cooperative in taking these precautions. And I believe my counterparts in Erie County are doing the same thing. I'm hoping that we can, keep ahead of this curve and keep our numbers low. I think the fact that our numbers are low here is truly a testament to our community and our ability to collaborate.
Thanks.
Okay, we do have Dan Trapp from 13 so we're going to start with him and then go to Jeff Luty.
Hi, Dr. Mendoza, Dan Schrack, 13 WHAM. Thank you for taking time out of your schedule to chat with us today. I want to first ask you about the governor's recent decision to allow school sports to resume and get your take on that. He said that it can be a district by district decision. What are your thoughts locally? Should local teams begin to practice and get ready for the upcoming seasons?
I'm comfortable with schools practicing, and I'm comfortable with the so-called low-risk sports starting to compete, largely because our numbers are low. I would like to see that we do not reopen everything too quickly, because I want to be able to follow the numbers. And schools reopening, sports reopening, colleges and universities coming back into schedule, that's a lot for us to follow. And so I am generally very comfortable with any one of these changes. My concern is making sure that we don't do everything all at once, because then we may not be able to track what it is that it might be driving a number going up, for example. But any of these individual things I am comfortable with. And as we've seen, as we've reopened things, we will look for changes in the numbers. But again, our number one protective factor at this point is that we're starting off with a very low prevalence rate.
All right, and then my second question is there a plan in place for certain schools when a teacher shows up and it is actually the teacher who is the carrier of COVID? They go through their first day of classes, and then the next day they have a whole new student body coming in that was learning remotely the day prior. What is the process in that situation? Does every student then need to quarantine or get tested?
Well, it all depends. And first of all, it depends on whether that teacher was wearing his or her mask or not. That will be the number one most important factor that we consider. And I will assume that all teachers will be wearing a mask as appropriate. And so at that point, we will start to look and see the duration and the nature of the contact with any students. I will want to exercise more caution rather than less. I've informed the superintendents that if we identify anybody, in this case a teacher, who might be positive, we're going to look at their classrooms and obviously send that teacher home, and then potentially close any of the classrooms that those teachers may have been participating in for 24 hours, just to allow us to do that contact tracing. Now, if it's a teacher, they have far more likelihood of interacting with a lot of students. We may need to close a classroom down for longer than that, but I've informed the schools that as best as you can, try to keep everybody in small cohorts as best as you can, because that will facilitate our ability to do the contact tracing and hopefully get, people back to school, as it were, quicker if that's appropriate.
Okay, we have about 5 more minutes, so we're going to take one question from each reporter, if we can get that all in, starting with Jennifer Lukey, and Patty Singer will be up next.
One quick question. Are you hearing from school districts about any possible school nurse shortages? And can you talk a little bit about how crucial they are really on the front lines of this back to school time?
I've always viewed school nurses as really the ideal extension of public health, because they are in our schools. They are in the front lines with our kids in ways that us as doctors and pediatricians are not. I've always wanted to find a way to engage school nurses more heavily in the work of public health and delivering vaccines and education and prevention and so forth. I'm not aware of any shortages at this time, though I am aware that a lot of school nurses may have maybe higher in age and may have other chronic medical concerns and may be reluctant to go back to school. I have heard of that, but I have not heard of any districts who have not been able to get nurses.
Okay, next,
Hi.
Patty Singer, and then Sean.
Several months ago, we set up the temporary mortuary trucks, and the convention center was retrofitted in case it needed to be a field hospital. Where are we now with what was done way back when? Are things on standby? Have they been shut down? Where are we?
Well, we still have those plans and we revisit those plans often. Our hope is that we never need the plans, but at this point, the plan will be essentially the same. The trigger points at which we will need to activate those plans are largely the same. We'll be looking at hospitalization volume and admissions and so forth. The main wrinkle, of course, is that when we implement that plan, it's likely to be much colder than it would have been had we implemented it earlier in the spring. So we're really looking at winter modifications to that plan. But otherwise, that's where that plan is at this time.
Thanks.
Okay, Sean Layman from the DNC, and then Andrew Friedman from Spectrum.
Hey, Dr. Mendoza, just going back to this Pittsford case, I'm wondering if the folks who were at that party have been cooperating with the contact tracing, and generally, have folks been cooperating with that process when you contact them?
In this case, I think people have been very cooperative. We are in the middle of the investigation, but what I'll tell you is that we only know who we are informed of, and there's no way really for us to know if somebody is holding back. So we believe everybody's cooperative. Our impression is that most people want to be cooperative. Yes, in other circumstances, I haven't heard of any since this investigation began last night, but yes, in other circumstances, people will hang up the phone and have choice words for us and so forth. But I think that is the distinct minority. In this case, people have been very, very cooperative.
Thank you.
Andrew Freeman.
Mr. Mendoza, I was wondering if you had any thoughts on the recent changes to the CDC guidelines.
Which changes are you referring to?
I guess the changes that have been kind of controversial the last couple of days is as far as when it comes to testing asymptomatic people and travel guidelines.
Yeah, as far as the testing of asymptomatic people, that one honestly came as a surprise to most of us in public health. In fairness, I really want to understand potentially where they might be coming from when they wrote those guidelines, but based on my read of it, I want to make sure that the public understands that we absolutely want to test people who might be asymptomatic carriers. Not testing those individuals is really sort of a throwing your head under the sand kind of approach that I don't think is appropriate. So we absolutely want to keep testing. And as far as travel goes, I've always said that travel isn't so much just the state that you're coming from, but thinking more thoughtfully about what types of precautions have been undertaken. If my mom, who lives in Chicago, were to come here, I would still quarantine her for 14 days, but I frankly wouldn't worry that much because I know she hasn't gone anywhere for a long time. So it really depends on a lot of circumstances. But when we think about travel, we've got to think about it much more thoughtfully than simply what state did they come from.
Thank you. Thank you for your time today.
Yep.
Kia, followed by Brett Eldridge.
Earlier today, Executive Adam Bella was at a presser where he handed out some PPE to school districts, and he said that one of the biggest challenges, one of the things we're really going to need to look forward is our testing capacity. I think you had mentioned earlier that we're not exactly there yet, that we might need to rev up our capacity going forward as we get back to school. So I'm wondering, what are your plans to get more testing or contact tracers, and where are you looking for help as far as where are we going to get these resources?
Well, the contact tracing capacity is pretty much taken care of thanks to the state, and we've had the need to increase contact tracing quite substantially as a result of the travel advisories. And so our quarantine numbers have largely been from traveling, and we've had to contact trace all of those individuals. So I'm less concerned about contact tracing at the moment. As far as test capacity goes, yes, we do have somewhat of a deadline. We want to try to increase capacity for testing by the time schools open. Our largest provider of test capacity is our healthcare system. So the University of Rochester Medical Center and Rochester Regional. So we've been in meetings with them, and we've shared with them our figures, and we've asked of them to improve what they can do even above and beyond what they've already done. They understand the need, they understand the community commitment to reopening schools, and they're all in. They're doing the best they can.
Thank you.
Okay, Brett Dahlberg, and then Dan Schreck will have a final question.
Thanks. Dr. Mendoza, will you talk a bit about what there isn't time for in the public health department right now, what you would normally be doing or what staff would normally be doing that they can't because of the intense time pressure required by the COVID-19 response?
There isn't enough time for me to sleep. That is the one thing I wish we had more time to do. Honestly, I look around my health department, I feel like everybody is pitching in, everybody is doing the work. Our restaurant inspections have continued in spite of the gym reviews that we've been doing, the work around the opioids, our grant work for healthy neighborhoods. Everybody's stretched thin, but I don't think there's a ball that's fallen and hit the ground. I think we are juggling a lot more in some ways because of but we are expanding our capacity through contract workforce, through volunteers, and there are almost 1,000 volunteers in this community who have stepped forward to help us out. But as far as the major commitments go, we're managing to get through.
Thank you.
All right, Dan Schreck has our final question.
Thank you. As I'm sure you're aware, our COVID numbers have been on a decline over the past several weeks and months even, but we are now nearing 3 weeks without a COVID-related death in Monroe County. What is that attributed to?
Well, I think that's a tribute, again, to all the things that we're doing in the community. I think that's a reflection of the reality that the average age of our cases has come down. And we know that those who were most at risk are people who tend to be older than 60. The total number of cases has gone down. So all of those factors taken together are what thankfully explain, in my view, why we have not seen a death, thankfully. And we want to keep it that way. We're entering the colder months with influenza on the horizon. Influenza vaccine is now available in limited areas in our community. We're going to be seeing more flu vaccine availability in the coming weeks. Encouraging people to get their flu vaccines, very, very important. We don't know what's going to happen with the flu. Many of us think that we won't see as much flu because people are washing their hands and keeping their distance and all of the things that we're doing to prevent COVID-19. But I will say that for those who do get the flu, I'm much more worried that they will be older people who are more vulnerable, who might also be vulnerable to COVID-19. And so my worry is that morbidity and mortality rate from influenza this year could be higher. So those are the things that we've got to be paying attention to. All right, everybody. Thank you all for all of your commitment to all of this hard work. I commend you all. I can't ask for a better group of partners in this effort than you all. So thank you all very much. Have a good weekend.